everybody. This is Jens Johnson, and we are here at the Big Bold You Show. I believe that we live in a world where there is a war between good and evil, and the only way evil wins is when good people don't do enough. So I'm the type of person that whenever I find a great person, I hitch my wagon to them and I don't let go, because that's how you succeed. And I'm telling you, I just happen to be hanging out. Obviously, I've been exercising, working out, and I've got somebody with me today, Dr. Dewey Lee. And Dr. Dewey Lee, I've known Dr. Lee probably for a little over a year now, and I'm you're the next Dr. Oz.
Thank you.
You are the next Dr. Oz, wow. And I think you're better than Dr. Oz.
Oh my God, please.
Hey, listen, it's my personal mission that I'm going to make sure he becomes the next Dr. Oz. But what I love about you is that you have a comprehensive approach to the way you deal with the practice of medicine, and the way you interact with your clients. You interact with them as a partner.
Yes.
So just kind of tell everybody what your approach is and how you got to that approach.
Okay. Well, first of all, it's great running into you, almost literally.
Yeah.
You look great.
Hey, listen, I look great because he's done a bunch of work on me here recently.
You. Yeah, and I appreciate the compliment about Dr. Oz and all that. That's really quite an honor. He's really, quite a figure. But so wow, the comprehensive stuff. And so where do I start with this? My whole philosophy is making sure that people have an active role in their own healthcare. Because, the way I see my role is that I'm a guide. Obviously, my role is to figure things out if something goes wrong and provide the right kind of treatment and things like that. But, unless you have serious illnesses of where that role takes place, but in terms of maintaining the health that you have and trying to propagate and optimize your own health, you kind of have to do it.
Right.
All I can do is, teach you and educate you and, guide you and show you the directions. But the steps you have to take is your own. And I've often used sort of analogy of a Sherpa. We all know what a Sherpa is. You go to Mount Everest and, you set up base camp, and the way to get up to the top is you have to have a Sherpa who can help you figure out and, take the steps that you need. Step here, don't step there, or if you step there, you're going to fall off. So that's kind of my role, is a Sherpa. And, in order to climb Mount Everest, you have to take the steps your own, right? Otherwise, it doesn't count.
Right.
So that's the things you have to do, is you have to take up your steps, but I'm there to help you and guide you and pick you up when you fall and show you the way to go. And so that's why I think what you're seeing is that sort of partner approach is really understanding the needs of individual patient.
Right.
And then coming up and discussing their situation. And then coming up with a plan that really works for them and encourage them and, make sure that they actually go there and do the program that we set out to do.
But what I love about you is, number one, when I say you're a partner in someone's health, it's not like a normal doctor-patient relationship.
Sure.
Everybody, and I know a lot of people that go to you because you have, is it 6 board certifications?
Yeah, kind of. Yeah,
I know.
Somewhere around there.
I remember when I met your wife. I said,
Yeah.
"How many board certifications?" She said, "I've lost count." I mean, he loves what he does, is what she said.
Yeah.
And that sincere love of people, it comes through, because whether you're working with someone with their brain health, which I think is vitally important, and I
Yes.
want you to talk about the work that you do with your brain,
Sure.
The whole approach that you use. But whether it's the brain, or whether it's hormones, or whether it's plastics, or whether it's vein, or whatever it is, you're it's not just a doctor client. It's more like you're equal with people,
Yes.
which is refreshing, and that's not normal. So, but I want you to talk about, your diamond matrix approach.
Sure.
And then I'll just kind of touch base on each one of those elements.
Okay, all right. So I don't know where to start. As far as the partnership goes, like we just talked about, it really is, equal. I have education and training and all that, but the people that I work with are highly intelligent and accomplished in their field. So, so my work as a guide, makes sense. I want to respect, what they have and, really help them to the best of my knowledge. The board certifications and all that, I really believe in learning. I think I'm a lifelong learner. And when I take on new areas in medicine, I want to be sure that I know what I'm talking about because
yeah.
I can't guide or help anybody if I'm kind of dabbling on something. It's like, no, I really need to become an expert in these areas before I can actually talk to people and be their guide and teach them and treat them. So that's why I go there and really become, at least achieve a certain level of knowledge and expertise, so I really feel comfortable that I am doing something good rather than, doing something half and whatever.
Right.
That's not my style. So as far as the Diamond Matrix goes, actually it is a culmination of the work I've done for many, many years. If I didn't have these boards and training and knowledge, the Diamond Matrix would not have come about because it really is a culmination of so many different areas of medicine that I'm practicing. And there are 7 points, 7 major points that I feel are the critical parts to make somebody healthy. And I actually am in the process of writing a book. It's called The Diamond Matrix: Your Blueprint to Happiness, Health, and Great Sex. Okay. So hopefully I'll get it done.
All the men are going to buy that book.
Yeah, men and women, both of them. Yeah. So anyway, the 7 points that are important are nutrition, lifestyle, emotional and spiritual health, and what I call regenerative medicine, which is modern area of medicine. And then brain health, which is at the bottom and the foundation, and aesthetic and cosmetic health, and the cosmetic area of medicine. And then in the middle of all that, in the center of the diamond, is sexual health. And that really is the sort of driving force that really, makes us do so many things that we do.
Right.
And often many patients will come see me because, especially guys, they reach a certain age and physiology takes over and they just can't have the sexual relationship that they want. So it's like, doctor, I kind of need some help in this area. And a lot of women come in as well because they have menopause and postmenopausal symptoms, and that's usually is the sort of impetus that a lot of people come in to see me because I need help in this area. So that's where the nutrition and regenerative medicine area come in to get them tuned up, if you will, to make them healthy and rebalance their hormones and things like that. And then the other part is I always tell the patients, you can eat well, you can have all the vitamins and all those kind of things, but if you sit around and be a couch potato, it doesn't go very far.
Right.
So lifestyle is important. So I get them on a program of exercise, even meditation, yoga, anything, right? And then one part that a lot of people kind of forget about is what I call emotional and spiritual health. And this is sort of a more philosophical area. It's very hard to describe in some ways when I talk to people trying to explain what that means. But for me, it really is finding a grounding for yourself, finding a relationship for yourself and of yourself, not only with you, of your own, but also with your loved ones and friends and, a larger community, and literally to the city and the state and the country and the universe. Because people really need to have an idea of identity.
Right.
This is
So
me.
true.
This is me. I am here. Even though I'm one person in this huge universe, I have a place. I have significance. And we know that because one person can do amazing things, right?
Right.
So I think that idea of I'm owning my own significance as a person and a being in this universe, I think really, really important to have that, sense of, rightness as you.
But see that I think that that's kind of my specialty is working with people in their identity.
Right.
And with what you're describing, there's no one else. There's no other medical person I've ever met in my life. And believe me, I know a lot of physicians. I worked in healthcare for 10 years.
Right.
But I've never met a physician that is so comprehensive. So literally when somebody is coming into you, whether it's to get their lips done or to get their veins done or whatever, you're looking at the complete person.
Right.
And I think, that's one of the things I think is your unique, your USP, your unique selling proposition. It's what makes you so, special and good at what you do, and the partner, because how many times have you gone into a physician and a physician is truly concerned about who you are as a person and how you connect with the world? Never. I've never had that happen.
Yeah.
So do you think that part of you is what really started the ball rolling with that comprehensive approach, or how do you think that happened? I know. See, we're here. We got all these. We got all these ex-NFL players in here. I should have them come in. But where do you think that desire came from within you?
I think it gradually evolved.
So
'cause
as you kind of got into all the different
I
areas.
started on surgery, and went to imaging, and then went back into cosmetic surgery, plastic surgery, vein surgery, all these kind of things, and then started the whole journey in regenerative medicine, anti-aging, and started really finding out that obviously so many of us are specialized, which is nothing wrong with any of that, and that's just the way it is in modern medicine. But for me, as I started to see so many different things, I thought, if I just specialize in one thing, I'm missing out, and I'm having my patients kind of missing out because, I mean, even in doing surgery, let's say breast augmentation or liposuction or tummy tuck or whatever, if the patient is not healthy, surgery doesn't go as well. They don't heal as well. You have increased risk of complications. So it's like, well, I mean, if I really want to serve my patient the best way I can, I kind of have to kind of tune them up before I actually do the surgery. You know what I mean? And so that is also a validation of sort of the comprehensive approach. The idea of the emotional health kind of ties in with brain health. I started doing the SPECT functional brain scanning that was developed by Dr. Daniel Amen many years ago. He still does it, of course. But so my approach is a little different. And then when I started talking to the patients about that SPECT scan, what it means, and functionally how that reflects their brain, activity, and then as I started talking to them about after the scan, going over the results, explaining them to them, and the symptoms they're having, then there's a natural communication and discussion about their emotional status, because often that's the reason they're coming in. And so that really started opening up the idea of, okay, let's help you figure out where you are, and not necessarily what you are, but where you are in this universe, because that has such an impact on your emotional state, and be it depression, anxiety, ADD, PTSD, so many things that we go through traumatically, even after concussion. We just talked about NFL player. There's so many people with concussion, and all these things really come into play. And so it really is a huge amalgamation of many factors that come into this, so.
Well, I was actually on the phone with a friend of mine on the way down here, and we were talking about her son, and she wants to have you scan his brain.
Sure.
And because we live in a crazy world, right?
Really.
We live in a world that there's craziness, and if you don't have the ability to block that out, and to focus on your identity and focus on what your purpose and your passion is, I mean, people, they're going crazy, literally.
Oh, right now, yeah.
And the thing is that if they knew what was going on inside their brain, I know people that literally, they honestly do think they're going crazy. And I said, you're not going crazy. There's obviously something happening in your brain, and you need to know what that is. But what I have found along my journey in life is that people, they self-diagnose themselves.
Yes, of course.
Or they end up going down this path where they find physicians that they do all these different type of medications. Nothing ever works.
Exactly.
And until you really know what's going on in the brain, there's no way you're really treating what is going on in the brain.
Exactly.
So I just think if somebody is struggling, or if life is hard, and you think, well, gosh, it shouldn't be. You need to get your brain scanned.
Yes, exactly.
You need to get your brain scanned.
It's funny because in psychiatry and psychology, they're dealing with the brain. I mean, that is the area of the concern, obviously, emotion and all those kind of things. And more often than not, that is the last area that is being imaged, and most psychiatrists, I mean, they talk to patients, and, you get the symptoms, and, often a medication is prescribed, or people will seek out therapists, who aren't usually psychiatrists did all the therapy, but now it's really changed in terms of how they do that. So the idea of actually looking at the organ that they're treating is sort of a distant thing for them, which is kind of strange.
I know, isn't it? It doesn't make sense.
It makes no sense. I mean, if you're an orthopedic surgeon, if you're going to do any operation on a knee or shoulder, first thing you do is get an X-ray and MRI. I mean, that's the beginning, right? I mean, without that, people will wonder, like, okay, you're going to operate on my shoulder? You didn't even look at it? It's like,
you don't even know what's in there.
Exactly. So that whole idea, is really kind of interesting because of the different profession. And, the SPECT scan is a little different than an MRI, because when I explain to the patient, SPECT scan is like, it's an anatomic scan. You go into the machine and you get a picture, you kind of see what the brain looks like, and that's how the most commonly it's done. There's something called functional MRI, that's a little different. But the SPECT scan that I use in nuclear medicine, it really looks at the blood flow in the brain and that how that blood flow is correlated with functionality of various different parts of the brain.
Right.
And so that's why you can actually get a functional data, functional
So
information in the
important.
brain that is different from like a CAT scan or an MRI. And that's why I can actually sit there and talk to the patient, listen, this area that affects your anxiety is really, really active. Well, no wonder you're so anxious and you can't go to sleep.
Right, exactly.
You know?
Exactly.
And you can't see that on MRI, you know?
No.
Yeah, so that's why you can actually do things like that. And all the area that actually has to do with ADD, you know, the part that really, you know, gets decreased, so your brain doesn't function, so you're always losing concentration, you can't focus, and you're procrastinating, all the things that we associate with ADD, that area of the brain is just not functioning very well. Okay, let's figure out a way to stimulate that.
Right.
So you will have less problem, you know, dealing with focusing and concentrating.
And you know, the thing is that what makes me so sad is I remember you came and you were a keynote speaker at an event that
Sure.
I've done, and when you were talking about how even in a marital relationship or
Yes.
or a loving relationship, you
Yeah.
know, you've got a significant other and there's issues. Well, so much of that can be tied back to there's something not right going on in the brain.
Sure.
And so, you know, what kills me is why insurance doesn't pay for it. They don't. But you know what? This is what in a year you will spend more on crap
Yeah.
in 1 year
Yeah.
than you would
On
on
a scan.
getting your brain scanned.
Right.
And if you care about your life, if you care about your health, if you care about your relationships, if you care about your identity, I am such a firm believer. Go get your brain scanned.
Exactly.
Go get your brain scanned. And then you won't even want to spend money on all that other crap because your brain is going to be functioning better.
Well, I mean, you can actually focus the treatment
Right.
to the areas that are out of balance. I
Right.
mean, right now we're just throwing medications at people.
Exactly.
Saying, well, you have ADD or you have anxiety, so here's some medicine for you. Oh, okay, try it for a couple of months. Oh, it's not working? Okay, let's try this one.
Right,
Okay,
right.
let's try it again. And so people are going through cycles and cycles of medications without really understanding, okay, why is this working or why not working?
Right.
So whereas with this technique, you can actually focus, okay, this area of the brain is out of balance this much.
Right.
We got to really start here.
Right.
Okay. And then we'll move on to the next one and things like that. But at least it's a focused, you know, very logical,
Right.
step by step, you know, pathway towards rebalancing and optimizing your brain.
Okay, so I want to ask you a question,
Sure.
and this might be our last question
Okay.
because this is completely impromptu. I
Okay.
mean, you
Yeah,
know,
it is. We just kind of came together.
So, what I want to know here in Dallas, Texas,
Yeah.
you have people that come to see you. What's the biggest draw for people to come and see you first? I mean, is it plastics?
Well, not as much as I would like. I mean,
Okay.
cosmetics. I mean, you know, I
Okay.
do a lot of surgery and you know, a lot of non-surgical.
Right.
So that's quite a bit. That's probably about 45-50% of my practice.
But what's the biggest draw right now to you?
That actually is cosmetics, and also a lot of injections and things like that.
Okay,
And surgery.
alrighty.
And then I'd say about 25% would be the brain.
Okay.
And then rest of it's more spread around between anti-aging regenerative medicine with hormones and
Okay.
nutrition and things like that. So,
And what
yeah.
what is? I know this is going to be such a hard question for you to answer. What is your most favorite?
My most favorite?
Right, your most. What, I mean, do you have a most? That's
Yeah,
like
yeah,
asking
yeah,
you
yeah.
who's your favorite kid.
I know, exactly. That's true, because I love all these things because they all kind of fit together.
Right.
I think my most favorite, you know, I'm a surgeon. I mean, I love
Okay.
doing surgery.
Okay.
So obviously, you know, all the breast surgery, you know, tummy tucks and all that kind of stuff that I do. I love doing that. I
Right.
mean, I literally spend hours doing that. I also love doing the non-surgical things.
Right.
What I call sculpting, you know, with fillers and fat and whatever, but really kind of fine-tuning the aging changes in the face and whatever, because that really is very delicate, you know, sort of artistic work.
Right.
And I love that. And I think I have a, you know, sort of an eye for it.
Yes,
And-
well, you
and,
did.
know.
He did my lips yesterday, and he put some filler in me, and I love everything that you've done.
Thank
and
you,
you
thank
really
you.
are. You're an artist. You are.
Thank you.
But the thing that I think is really unique and spectacular all at the same time is that however somebody comes to you first,
Yeah.
you know, you can help in so many different ways. And one of the things that you have helped us so much with is the COVID antibodies test. And so that's definitely something too that and I remember you said, listen, if there is a need and my patients need something,
Sure.
because of the comprehensive approach that you have with your medicine, you said, I'm going to take care of this.
Yeah.
So I love it.
Well, thank you. Yeah, the rationale for that was really almost emotional and psychological as much as
Right.
medical, of course.
Right.
Because, I mean, I've been doing this for about 6 weeks now. And back then, we're in the middle of this huge pandemic. Everyone was afraid of everything. And you literally had families separated. They couldn't literally even see or touch each other. It was like, God, this is crazy time.
Right.
All because of this fear. And it's like, are we, do I have this? Do I not? Or do you have it? Or do I go near my mother and father? Or, nobody really knew what to do. I
Right.
thought, this can't happen. So when I found a very high quality FDA approved antibody testing, I thought, okay, this could be a key for a lot of people.
Right.
Because number one, once you know your status, am I infected? Am I going through an infection? Or did I have an infection in the past and I have
Right.
antibodies now? And, that kind of shifts the dynamics of how people interact with each
Yes.
other. Because I have patients come in, they tell me, well, I live with my parents, but they're in a different section of the house, and I haven't had dinner with them for weeks or
Right,
whatever
right.
because I'm so afraid. It's okay. Well, once you come in and get tested,
Right.
and once you get tested, okay, you have nothing. You've never been exposed. You don't have any antibodies. You're as if you were before all this started.
Right,
You're
exactly.
normal. You're not going to infect your parents.
Peace of mind.
You can go home and can go hug them and
Right.
have dinner with them and be safe in mind thing. I'm not going to, kill
Yes.
them because
Yes.
that's what they're afraid of.
Right.
So that alone takes a huge weight off of them. It's like,
Mm-hmm.
wow, I can wear a mask because, that's the norm these days, and hopefully they'll go away. But, I have to do that outside. But when I go home, I can take this off
Right.
and be like a normal person and be a family and not
Exactly.
be afraid. I
Exactly.
think that is such a huge, powerful message for people. Listen, let's go back to as much of a normal life as we can, knowing
Right.
with the knowledge that truly you are safe, that you're not infectious, you're not going to endanger somebody.
Well, I know for myself personally, before we sign off here, that's exactly how I felt. I wasn't high fear, but I do have a father that's
Sure.
89, and I do have a father that's diabetic, and the minute our whole family was tested and we all came back negative, it was immediate just sigh of relief, and we really did go back to normal.
Yeah.
We went back to normal. We just we didn't even think about it anymore.
yeah.
So you can see why Dr. Lee is so amazing, and I will tell you, Dr. Lee, everything you've ever done for me, everything you've done for any of our friends and family and our big E-Woman Network
Yes,
group,
yes.
It's just been phenomenal.
Well,
and
thank you.
You
Thank you
are
so much.
you are truly a life-changing person to
Wow,
have on your life team.
thank you so
So
much.
if you don't have a physician that is on your life team that can help you in a comprehensive way, and I personally have never met another one, you need to look up Dewey Lee, Dr. Dewey Lee here in Plano, Texas, Advanced Surgical Care. Surgical Arts,
yeah.
Advanced Surgical Arts. He is an artist and he is an incredible person. So until we meet again, everyone, be big, be bold, and most importantly, be you. Bye-bye.